Yes, actually, yeah. My stepfather had quadruple bypass surgery, so I think we had like full blockages and stuff like that. But yeah, and it was yeah, he was sick for a really long time after that, and luckily he's good now. Yeah, I think for sure, especially like even just with AI, seeing how much like AI things like ChatGPT have like become household names. Having something like so readily accessible like a phone, and then combining that with like the real world helpfulness of an AI that we've already seen, like it's not as much of a scary thing I think as a society anymore. That putting those two things together, like I think easily it'll just be everyone will be doing it. It'll be just yeah, like exactly like you said, something like if you feel some sort of strange like faintness or something, you can just test that out before you go to the doctor.
Yeah.
I think it's really just like from talking to Yaroslav as well, he's such a talented physician that when he speaks about how like the things that it can detect, when he's like he sees it as like another doctor. Like when he's like it's doing the things that I could do. So hearing that from him is pretty cool. Just like the ability for it to detect such like intricate abnormalities. That's pretty cool. I'm not sure. That's a really good question because I know Yaroslav was saying that like there's been a lot of doctors who are really excited about using it. So I think that's hopefully that's the feeling of most doctors out there, and they would be really like open to it because it just relieves so much pressure on the healthcare system for like in that it's just like an initial screening process. I can't really see any doctor being that against that unless they have like a ego problem or something like that, you know. But I think if I took it to my family doctor, I think she'd be very open to that, and then you can follow up. But the initial screening's been it's just a step that they don't have to do, so I think they'd really be open to it. Yeah. 100%. Yeah, it's kind of like even on my last answer there. It's especially in Canada right now, we're seeing just like healthcare systems are like so burdened that I just think having something like this where you know if you're just feeling off and you can do that, it's just like an initial check, and it's an initial screening that is just going to take a lot of I think weight off of the system where you don't have people going in and taking up doctors' times for something that could maybe just be initially screened with this, and then if it's something abnormal, then you can go in. But I think that will be a major a factor in alleviating some of that pressure. Yeah. 100%. I think this is something that I don't think should just be up to word of mouth, and it's good to hear in Mark's initial talk there that like the government of Newfoundland the provincial government has been quite supportive of this, but I do really think that the federal government only serves to benefit from like promoting it and just really like it's good for the health of Canadians. Like it doesn't really have a drawback, and I think having something as powerful as this spread only by word of mouth is like a disservice almost. So I do think like getting it out there, having it be something that's like I'm sure there's some sort of like conferences or there's probably some way federally to disseminate information to the medical force out there. So I think like having that be in more of like an official pipeline would be extremely valuable. Yeah.
Awesome. Thank you for your time.
Thank
you very
you
much.
so much. Yeah, have a great day.